Welcome back to the Daily Rundown on That's Manchester Channel 7 with me, Paul Burgess, and our brilliant guests, David Semple and Loz Kaye. Time for another story. Are you ready?
Yeah.
Yes, let's go for it. The High Court has told NHS England that it can fund a new drug to prevent HIV after health bosses argued it was not their responsibility. NHS England had said it is the responsibility of councils to provide the pre-exposure prophylaxis PrEP drug, as they are in charge of preventative health. The stance was challenged by the National AIDS Trust, and a judge said there was nothing to stop the NHS paying for the drug. But that does not mean it will now be automatically funded, as NHS England has already announced it will appeal the ruling. Using PrEP has been shown to reduce the risk of HIV infection by more than 90%. Do you think that NHS England should fund this?
Yes, it's very, very quick. There's been quite a lot of polemic about this whole decision and about the NHS and is this the right thing to do and so that. And there's only one thing that matters in this. It works. The figures that I've heard that it's been also already tried in San Francisco, for example, they've seen a 33% reduction in transmissions.
Wow.
Which is also for something that's been hugely resistant. Also, some big shifts like that. That's an extraordinary result.
Absolutely.
In the UK, in terms of the latest statistics that we've seen, that currently there's something like 107,000 people living with HIV in the UK, and that's up slightly, but it continues to go up. So we have to ask ourselves, this remains a health crisis. Mm-hmm. We found a way to eliminate or something which is helping to go towards the goal of eliminating HIV. Now that's to me, that has to be the goal. It's not just about saying, okay, that we want to make this a manageable condition, but can we continue to work towards eliminating HIV? This is our best shot. This is the best shot that we have at the moment in terms of the results that we've seen. So I think it's very disappointing that the NHS are England are dragging their feet for reasons we all understand, to do with, I think chiefly to do with money, but nevertheless, PrEP is a really important step forward.
I can't believe the NHS actually said that. I'm a doctor, right? Oh, I'll wait for them to get sick and then boom. Well, the doctor should be about getting people not sick in the first place. The NHS is owned by the people. It's not its own body like the Soviet Union. Their job, it's not the council's job. The council has nothing to do with health. Their job as a medical profession is to make sure people don't get sick in the first place. If this drug is widely available, it saves the NHS a ton of money later on, can't they? I tell you, the people we've got in medical school today aren't very bright, and the bureaucrats we've got working for the government aren't very bright. That is bureaucratic nonsense. Anything to prevent anybody getting anything, cancer, anything, should be available before, so people don't have to end up in the NHS unless they want to keep the business up or something like that. I think the NHS is already overused, and the medical profession, it seems to me, is behaving in a cowardly way, because either and our civil servants, the person who said that works for us. We pay for that person's salary in the taxes. Can't they think? Can't they get their brains together?
Yeah, I mean, you're absolutely right in terms of it also being cost effective if you want to kind of look at it in that way.
Plus, because it's people getting sick.
Well, exactly. Because obviously there's fantastic breakthroughs that have been in terms of medication to manage HIV and AIDS. But that's also something that we want to be aiming for: zero transmission, zero deaths, and also zero stigma as well about HIV/AIDS. I think this is the other thing that's been, I think, really unfortunate about how this has been. Some of the reaction to this story is like, all this has to be about is to say we want to eliminate a disease. everything else, just put that aside. But also, I think just acting this way, it also seems to reaffirm some of the kind of stigma that is around HIV. So that also it's really important that we say that this is a disease. We treat it in that way. And after all, that for example, the French can afford it at the moment, so I don't really see why we can't. The point about the councils is because preventative commissioning is being sort of shoved over in that direction. But I think it's incredibly...
Yeah, but ultimately, when you go to the doctor, right?
Yeah.
You get your 5 minutes, gone, right?
Yeah.
That sort of thing. The important thing is, if they were into... In fact, if all the... Remember when Tony Wilson was dying and he couldn't get the medication on the National Health and he had to raise money for it some years ago? The fact is, all of this should be available in the National Health so people don't die and people don't get sick to go to the hospital. It's preventative that's the most important. I would make everything available, and it's worth the taxpayers' money to pay for that. And because I'm sure they could sack some of these bureaucrats in the NHS who are giving speeches like that, so it'd be so cynical.
But I think it's also in terms of I think there's one thing that the NHS England were right to do is also to talk about putting pressure on in terms of Gilead, who's the manufacturer of Truvada, which is the brand name of prophylaxis. So they're right to talk about asking about the price of it. Yeah, sure, of course. Do that. Put the pressure on. Also, have the discussion about how do we fund pharmaceutical research. What we mustn't do, though, is do what Jeremy Corbyn did, which was made this very extraordinary sort of statement about suddenly, as part of the leadership campaign, they say, well, okay, we're going to completely get rid of tax relief in terms of pharmaceutical research. By all means, I think he's right to ask questions about those companies, but also we can't be making that kind of policy up on the hoof. Not in the Labour Party, but also not for NHS
deals out of those companies. I mean, people in the NHS couldn't negotiate their way out of a paper bag for the most part, and a lot of those drugs you can get from other sources. At cheaper cost, a lot of the stuff they buy in the NHS. I'm sure there's a lot of corruption in there. It's not as bad as Obamacare, where all the drug companies get massively subsidized. Did you know that? The GlaxoSmithKline, those are the people who get the money. But I think the NHS has a duty to everybody in the country. We pay taxes for it, and they don't want anybody to end up in hospital unless they get run over by a car. And the doctors should be into preventative. They should be into that much more than you're all right, I'll give you a pill and go. You know, I don't think GPs are that good in this country.
Well, when you've got, pharmaceutical companies, I used to work for the health service as a health trainer, when you've got pharmaceutical companies turning up at doctors' surgeries with whole buffets so that they can, juice up the doctor and say, will you prescribe our pill? There's a lot.
At medical school too, you get the cup and all that from GlaxoSmithKline.
Let's move on to another story. The founder of a flagship academy has been found guilty of defrauding the government out of £150,000. 3 staff members made payments from Department for Education grants into their own bank accounts. The grants were given to set up King's Science Academy in Bradford. The Crown Prosecution Service told the court the trio had treated public money as their own. This isn't the first story we've heard about academy trusts defrauding the government. Between 2013 and 2015, there were at least 58 claims of financial irregularity at academies and free schools. What do you think about that?
Well, it looks like academies haven't worked to a large degree. There's been a lot of... like you hear about people acquiring a school which was state-owned, and then it becomes owned by this academy trust. They sell off the tennis court for £450,000 and pocket the money, and then the guy running the academy gets a fortune because I can create a lot of business. I'm sorry, running a school isn't creating a lot of business. I think the whole idea of academies, from the moment Blair, ADT College Putney, brought them in way back in 2001 or whatever, in 2000, was a very bad idea. They should have just concentrated in making the existing schools work. I would have opened more grammar schools and just made the existing schools work. But handing the schools over to a bunch of crooks...
Yeah, well, but also this is equally about the kind of the free school program, which is kind of also came in through the coalition, and I think
I have
this,
some sympathies if it's the right people.
Yeah, well, I thought yes, I thought in terms of the free school program, there was a good idea in terms of opening up different ways to also innovation in education, but the big problem has been also centralising the control into the Department of Education. That was a mistake, and we can see with what's happened with this is that also they simply weren't able to control the finances. That also that's what happens with that kind of massive centralisation. So for me, also we need to be looking back more towards local control rather than Department for Education control. Otherwise, we're going to see repeats of this kind of case.
Yeah, but we can't have the councils like Bury Council suddenly pulling its money out of schools, claiming they don't have the money, then hanging on to the people who are doing those jobs, and then the schools are forced to go and try and qualify to be academies in order to get some money. I mean, a lot of local governments in England play a lot of dodgy games, don't they? I mean, let's look at it.
Perhaps it's time for an overhaul of our entire education system, including, of course, university costs. But it's time for another break now. But we'll see you again in just a couple of minutes on the Daily Rundown here on That's Manchester, Channel 7.